But hi, good afternoon. My name is Dr. Catherine Brodowski. I'm the Director of Public Health and Research at the Greater Boston Food Bank. So I am a physician by nature, but I'm out there trying to solve these really root problems that address a lot of chronic diseases that we're seeing among patients. And food insecurity is at the heart of so many different health conditions that we see in our clinics, including diabetes, including depression, mental health concerns. Many patients who are addicted are also food insecure. So we're trying really to connect people who are hungry with food resources. And we realized at the Greater Boston Food Bank, we're really good at food. We distribute, can anybody take a guess at how many million pounds we distribute? I'm just gonna float it out there. Anybody want to take a guess? Just imagine a 5-pound potato bag. How many pounds of food do you think we do a year? Just to get it lively. But so we do 54 million pounds a year of food distributed throughout eastern Massachusetts, and I can show you a map of that. We also have more than 500 agencies, so food pantries, meal programs throughout eastern Massachusetts. What we are rolling out with community health centers is a 3-pronged program. So I'll refer you to this quick visual and then we can get into specifics. But the first part is a mobile market program. So we know that folks who are low income, who are likely to be food insecure, it can be very difficult for them to procure healthy, whole, fresh fruits and vegetables. So we want to help by providing free produce-only mobile markets to community health centers and centers that really see a lot of the low-income population that are food insecure. We start with once-a-month distributions. We have giant trucks that come down. We will give you as much food as you want. If you start off, let's say, with 4,000 pounds and you grow, we'll give you all the way up to like 25,000 pounds on a truck. So we work with you to grow with you to serve the needs of your community. And as we partner with each site, we will understand each site's better and your needs at your current site. So that's mobile market. It functions as a drop, and Christina will explain this in a moment through the mobile market logistics. But basically, we do a drop with our food. We coordinate with health center staff, and staff and volunteers set up a farmer's market style distribution with this food. Again, it's all free. We do volunteer training. We give you all the technology to support this, and we'll talk about that in a moment. But this is just an overview. The second thing that we offer to folks is a screening program. So we're really encouraging health centers to start screening their patients for food insecurity. We basically want to answer the question, is food insecurity a problem at your site? And if so, how large is it? You know, it's very likely that your patients are food insecure, but there haven't been a lot of good measurement or studies done on this. We know in general 1 in 9 households in eastern Massachusetts are food insecure, but our guess is that community health centers are going to be hotspots. We are working already. We've met our goal this year of having 2 sites working with us already, Charles River Community Health and Greater Lawrence Family Health Center. Greater Lawrence incorporated the screening into their EMR and is showing already 63% of their patients are food insecure. It's a preliminary finding, but it's very eye-opening. That means the majority of the patients are food insecure. So I'll talk a little bit about that, about screening, and we work with you to integrate it into your workflow. Again, it's an option, so it's something that you can choose. The last thing is the toolkit. So we don't want to just refer patients to our mobile market. We want to really connect them with all the wonderful local organizations that are here in this community, which is where hopefully maybe Dr. Dave Weed comes in and can help tie us to all these great things that are going on. Every community is different. You know your folks the best. So if there's great nonprofits in the area, we want to connect them. Local food pantries, SNAP, WIC, whether you have those services in-house, or different organizations locally for nutrition and cooking education. That's kind of an overview of the program we're doing. And today is more a logistics meeting. So how, if you would like to pursue this program, how can we go forward? And I set a couple different agendas, items on the table here. We can start with a quick introduction also by Christina Peretti, who is magnificent at setting up mobile markets. She's been doing this for years. She knows everything. Ask her any question that you want to, but we can kind of tackle through the items. But do you want to give a little introduction to yourself and maybe we can hear just an introduction of everyone and then go forward.
Yeah, definitely. So I'm Christina, the manager of community initiatives. And so my team manages all of our direct service programs. So Michelle and Allie, who you would both probably meet, and we sort of just handle all the logistics. So walking through site setup with you, distribution setup, training on registration systems, and then we would be the ones placing the order every month and communicating with you what's on the order, how many of each per client, and then checking in with you after the market. So sort of all the month-to-month logistics. So this is something we've been doing for a number of years. So this is just a little bit of a twist on it, but we have been operating lots of mobile markets over the years. And everyone's a little bit different, so it will take a little while to figure out.
Get started on, I guess, some of the lists.
Sure.
Christine is going to give us an overview of the mobile market and kind of go down the list. Please stop us at any point, and we can tweak, we can tinker, we can answer questions, but we just want to introduce you to the program and go about some setup items to discuss.
Definitely. There's a lot to go over, so I'll just give you sort of a high-level overview of each thing, and then we can talk about it more in depth. So our truck would come, truck will drop the pallets, and then the truck leaves. Generally, we would try to set you up with an agency partner in the area. If you had extra food, they would be sort of on call to come and pick up any leftovers. So truck drops the food, volunteers set up the tables, set up a registration table, and then clients come in and shop. Let's see, as far as equipment, there is some minimal equipment we would ask you to store. We can either provide tables, folding tables if you don't have them, or use any tables you have. We usually say 6 to 8 tables, maybe the length of this one. And again, are happy to provide them for you if you have somewhere to store them. Box cutters to help you open boxes. Sometimes we provide freezer blankets. They just sort of roll up like a big sleeping bag, maybe 1 or 2 of those, just in case you had any produce that you wanted to cover if you were doing it on a hot day or something like that. They don't take up a large amount of space. And then a scanner, which some sites use for registration. So registration has sort of 3 parts, and Dr. B will tell you more about the hunger vital signs, screenings, and consent forms. But basically for registration, we ask clients to pre-register. They only have to register once. They answer basic questions, first, last name, zip code, phone number, just in case you have 2 people living in the same zip code with the same name, just so we can keep them apart. How many people are in your household, whether or not you receive SNAP. You can choose not to answer that question. Those are all the basic ones besides the hunger vital signs.
And I'll be giving you also a handout. I have a handout of that showing what we ask and then any other questions that you might like to ask as a health center, and I'll talk about that later on the data piece.
We try to keep it pretty basic. Some folks are a little bit nervous about sharing too much information, and it also makes it challenging for volunteers, especially if there are language issues. So while we can collect any sort of information you all would like to, we try to keep the amount that's required pretty simple. So folks would register once, the first time only. After that, every time they come to the market, they'll just need to check in with whoever's doing registration. We use a computer program called Oasis to do registration. So we would come down, teach whoever's going to be your registration folks how to use it, and then be with you the first 1 or 2 times to walk through registration with you, just in case you had any questions. Have you guys thought at all about which department will be doing registration, or whose responsibility that would be?
Yeah.
Okay.
And I'll say also the really cool part, if I can, of this program with the technology that we provide to you is that each client will get these really neat scan cards. So it's similar to when you go to the grocery store and scan on in. When they come to the market, they'll just scan in right away. We'll give you a scan gun to process them. And at the end of the market, with a click of a button, you'll know exactly how many people you served, how many children, how many adults, and how many seniors. So it gives you that feedback that you want and allows you to see, really measure how your program's doing.
You can run tons of reports in Oasis. It's really helpful for you to know who you're serving and how many folks you're serving. Generally, we recommend that there are a small handful of people who are entering clients into Oasis, just so you have some control over how many people have access to it, make sure the data is good going in. And then a couple folks who could be the same people or different people doing check-in registration the day of the market. We usually say maybe 2 people the day of, just depending, if your market grows, you might want to add a third, but 2 people is usually enough. So the day of the market, folks would check in. Most sites are using the little scan cards, so you would just need to produce those, have them ready for clients. Usually that might be the second market that you have them ready, and then every market after that you just need to produce additional cards for the new registrants. So folks check in, we'll provide you with a scanner. Folks would check in by scanning their card. You just confirm the information on the screen. We do suggest when clients check in to give them either some sort of ticket or a hand stamp or something so that volunteers handing out the food can know that that person did stop in at registration, and so they also know who's together in a household. We distribute food per household, so it's usually about 6 to 8 items per household. So sometimes you'll have 4 adults who come together to shop, but you need a way to identify that they're all together as part of one household, and a ticket or a hand stamp will do that. It generally takes a couple months to get into sort of a rhythm. After that, we probably won't have to communicate about that back and forth every month unless you know that something has changed. You've decided to open it up to the community, or you've outreached to a certain group or an organization, and we want to take that into account when ordering. And then the day before, we'll send you a list of what the items are and how many per client. So we'll say squash, 1 per client, potatoes, 1 bag per client, etc. And let you know if anything needs to be bagged. So we try to send stuff that's already bagged as much as possible. But things like apples will probably need to be bagged, so we would let you know if we're sending apples, they do need to be bagged, and this is about how many go in each bag. As far as volunteers, depending on the size of the market, we usually say about 10 to 15 volunteers are a good number. Again, if you have the same volunteers returning every month and are really proficient, you may need a little bit less. If you start off lower, you may need less. We have sites that distribute to 700 clients and they have 30 volunteers. So the number of volunteers will go up as you serve more clients. We would certainly come the first 1 or 2 markets, train volunteers. After that, it generally works best if you have somebody who is sort of in charge of volunteers and who's training volunteers, new volunteers every week or every month, telling them what to look for, that sort of thing.
One thing on the volunteers. One thing I wanted to point out, so some folks, some health centers may have a volunteer base to draw from. Other health centers, that might be a new thing for them. So we've encountered both types. At one health center, at Charles River, they found that they were new to getting volunteers for the community. It took a very short time period for them to actually get a lot of volunteers, and it actually intertwined the community so much more. They are building such a fantastic infrastructure. So now they get volunteers from the community, they get patient volunteers, they get elders who feel like, wow, this is such a great opportunity. I want to get out of my house and I want to really help distribute. This is really meaningful to me. They get local corporations. So we have New Balance coming to volunteer at our mobile markets. We have Harvard Business School. We have medical schools. So you can really get the community involved so that the community really owns the market. So it's everybody's market and everybody is pitching in. So I just wanted to share that with you as we're going through. We can talk more about that if that's an area of concern with volunteers.
Definitely. Sort of skipping back a little bit, another thing to think about, and we can sort of talk about this when we look outside too, is there will be trash from the market. It's mostly cardboard, some plastic trash, depending on what the items are, and since our truck drops and leaves, we do leave the wooden pallets, so you would need to be able to dispose of those as well. While folks are setting up the market or distributing at the market, that there's somebody cleaning up as you're going, so you're not left at the end of the market with all the trash. There's folks handing out food, there's folks continuing to bag, and there's folks cleaning as you go. So here's an example. We do provide a calendar with dates for our fiscal year, which is October through September. We have a template. We can certainly pop in your logo, Any other information?
And also, we try to be respectful of the language that's predominantly in your community. So for example, this one, we have both English and we have Spanish. If Spanish is the predominant other demographic that you're serving, we can do that. If it's a different one, Portuguese, Vietnamese, whatever, that we want to make sure that we are, again, decreasing the barriers and people know about this resource. So just let us know.
We can also provide you with a poster about the size of that whiteboard there. If you wanted to put it in your lobby or somewhere, let people know that it's coming up and then the day of the distribution. Last thing, Board of Health. We do recommend that you check in with your Board of Health, let them know that this is going on, ask them if there's anything they require from you, just so they're aware and that it's not a surprise.
So why don't we have an email conversation to follow up on that piece? We'll check with our folks. You can percolate, and then we'll have a conversation online, see what works good for everybody.